Yes, sir. Yes, sir. Yes, sir.
Okay,
You are
so
audible.
namaskar
We
and
can proceed it.
happy Navratri to all of you. Today, the second day of the Navratri and blessings are there. So we are going to start the workshop. First of all, I would like to thank Dr. Adnan Sheikh to organize this webinar. It's very good webinar, and there are huge responses there. So many candidates are from North India, South India, and out of India also. They are joining us. A very good thing. So we will continue the presentation, and after that, if you have any query, any question, you can ask me directly. We are try our level best to ask any to solve anybody's doubt. Okay. So without wasting the time, it's already 9:40. So we are going to start. First of all, it's my screen is visible.
Yes, sir. Yes, sir.
Okay, okay. So today we are going to discuss about the chiropractic, the role of chiropractic in today's physiotherapy patients, and we are seeing a lot of cases from past many years. We are using general physiotherapy, and now there is some advanced techniques are there in physiotherapies, just like chiropractic adjustment, the cupping therapy, the dry needle therapy, and a lot of therapies are there. So what is the difference between the advanced thing and the past thing? Just before 2 or 3 years ago, we are seeing if any low back pain case, we are seeing the case for 1 and 2 months, for 3 months, and not able to give the good response. But nowadays, when we are doing the assessment and when we are doing the treatment, we are getting the good result by in a single visit and in 1 minute or 2 minute treatment, we are getting the result. That too without medicine, without painkiller, and without steroid. So this is my introduction. This is Dr. Puneet Chobe, having more than 22 years of clinical experience. I'm having more than 22 years of clinical experience. And as far as academics is concerned, from past 6 years, I'm taking the classes, I'm taking the workshop across the country, and we are getting very good response. The difference between our workshop and another workshop is that in our workshop, we have the more of the 90% practical session. We do the proper assessment of the patient, and as per the assessment we apply the technique. It's very easy to apply the technique. कोई भी आदमी कैसे भी करके टेक्निक अप्लाई कर सकता है, बट द मेन थिंग इज दैट असेसमेंट, हाउ यू आर डूइंग द असेसमेंट. Assessment part is very important. That is very, very, very difficult, and treatment is very, 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 very easy, because if you do the assessment properly, you will get the result. Nowadays, everywhere, whatever we are seeing, chiropractic, chiropractic, chiropractic. Everybody is just running behind the chiropractic, chiropractic, chiropractic. But also, we are getting a lot of complications. Also, we are getting a lot of complaints. Also, why it is coming so? Because there is lack of assessment. No, the therapist is not doing the proper assessment. They are just applying the technique by seeing on the YouTube or any video. They are just applying to the patient, and in the patient also they just want to get the adjustment first. They are coming to the center and ask for the chiropractic adjustment. And one more thing, everybody is running behind the pop-up sound, pop-up sound, pop-up. कायरो कराया, pop-up sound निकल गया, बस treatment हो गया, assessment हो गया. तो बल that is the reason why we are getting a lot of complication in our daily practice. So it's my humble request to all of you, you should do the proper assessment of the patient. If chiropractic is required, then only go for the manipulation. If chiropractic is not required, go for the mobilization. Go for the mobilization, you will get the result. Unnecessary thrust is very, very, very dangerous, because if there is thrust is not required and you are doing the unnecessary thrust, that is very dangerous. It may harm the patient. So don't do the treatment as per the patient request. It's my request to all of you. Don't do the treatment on patient demand. If the patient is demanding that do this, don't do it, because you will be in harm, because assessment is very necessary. Patient is not known about the assessment. They are just doing the treatment. So I'm having more than 22 years of working experience, and we used to take a lot of workshop, not only chiropractic, we used to take the workshop of cupping therapy, dry needle therapy, ISTM, a lot of workshop we used to do. So slide. So, as we in our daily practice, we see a lot and lot of cases who are suffering from back pain and neck pain. In our day-to-day life after COVID, everybody is just using the mobile phone, they are using the laptop, and due to the lack of exercise and due to lack of nutrition, they all are suffering from the back pain issue and neck pain issue. If we consider our daily OPD list and we will just differentiate the patient, then I think more than 60% or 70% person, they are coming for the neck pain and back pain reason. The reason is that due to the lack of exercise, due to the lack of nutrition, and due to the bad posture, they are getting more and more problem. So before starting the chiropractic thing, let's see what is the basic spine and how it looks. In basic spine, we see this is the structure, this is the hard structure, this is the bone structure, which is known as vertebral body. This is the vertebral body, and this is the vertebral body. Between two vertebral body, there is a disc kind of thing. Disc means that is known as jelly structure. It is used mainly for the absorption, shock absorber, and for the protection of the nerves. In between this jelly structure, this bone, there is the nerves. We have the spinal cord nerves are going through this, and that is very important to know the proper structure. We see a lot of MRI in our OPD cases, and we are not able to know that what exactly the patient is having problem and what the that thing is written. So by seeing this structure, we can easily able to understand that what is normal structure and what is the affected part. This is the normal disc. वी आर सीइंग द बाउंड्री. ये जो हमारी डिस्क है वो एक बाउंड्री के अंदर में है. नॉर्मल स्ट्रक्चर है, एक हेल्दी स्ट्रक्चर है, जो कि हमारी दोनों बोन के बीच में है. This is the structure where we are seeing the degenerated disc. As we see a lot of cases for the osteoarthritis, there is degeneration of the bone. Same as in our spine, there is degeneration of the disc, means there is degeneration of the disc. So it is known as degenerative disc. Why it happens? It happens due to the overpressure. As in our osteoarthritis cases, when we see there is overpressure to the knee joint, there is this rubbing of the knee joint, and there is degeneration of the knee joint. Same as when we have a lot of pressure in the spine, there is prolonged low back pain, prolonged standing, prolonged sitting, there may be degeneration of the disc that may cause due to the overweight of the patient. Patient का अगर overweight है उसकी वजह से भी ये problem होता है. Now next point is disc bulge. This is very common word, that disc bulge. Even the patient calls me on the phone, sir, I am having the disc bulge between L4 L5. I am having the disc bulge between C4 C5. We ask the patient क्या हुआ problem, तो बोलते हैं मेरे को disc bulge हुआ है. Even the patient is already doing the assessment. But my dear friends, this is my big mantra to all of you. If we are seeing the back pain cases in our clinical practice, it's my experience, and it is being documented also that a lot of cases of low back pain, whatever we are seeing in our clinical practice, it is coming from the pelvic region. Disturbed pelvic. We have to do the assessment first. Assessment is very necessary because pelvic is disturbed. Even I see the cases of the neck pain in our OPD. In my OPD, I just do the adjustment of the pelvic. Their neck pain goes away because that is coming due to the disturbed pelvic. So pelvic is the center. The COG is transferred through the S2 vertebra. That is coming through the pelvic. So our base of the body is pelvic. So always it is recommended for a good chiropractor, for a good therapist to assess the pelvic, the alignment of the pelvic, and to correct the alignment of the pelvic. That is very necessary. अगर आप सीख गए कि अलाइनमेंट कैसे करते हैं pelvic का, you will become the master. If you know the how to do the adjustment of the pelvic, you will become the master. You will do the adjustment in 1 minute, in 2 minutes, you will get the result, 100% result. And that is I used to do daily a lot of cases. I used to see, and I just do the adjustment of the pelvic, and we get the result. So it is disc bulge. Disc bulge means the disc is coming out from the boundary. Disc is coming out from the boundary. So when a number of people used to ask कि disc bulge होता है तो वो हमें क्या relief मिल सकता है by chiropractic adjustment? Can we do the adjustment of the disc? So the answer is yes. When we used to see the any paste or to any toothpaste, it is coming out from the toothpaste, so we can adjust it. So it's just like the jelly structure. If your assessment is good, your proper diagnosis is good, you are very easily able to do the adjustment to do the treatment for the disc bulge. Now, next thing is disc herniation. What is disc herniation? Herniation is just passing the across the boundary. If the any part is crossing the boundary, just like we have abdominal herniation also. हमारे पेट में हर्निया होता है, पेशेंट आके बोलता है कि हमको हर्निया की शिकायत है, हर्निया की प्रॉब्लम है. सेम थिंग, द डिस्क ऑल्सो गोज टुवर्ड्स द क्रॉसिंग द बाउंड्री. ये डिस्क हमारी यहाँ से बाउंड्री को क्रॉस करके दूसरे स्ट्रक्चर में इट इंटर्स टू द डिफरेंट अनदर स्ट्रक्चर, सो इट इज नोन एज डिस्क herniation. Now, what is this thinning? This thinning, this thinning is reduction the space of the disc. Disc का space कम हो गया. This is very important. अभी जो मैं slide start किया हूँ आपको, यही बहुत important slide है. इतना ही समझने में आपको बहुत time लग जाता है. And that is not treat in your that they are not taught in your BPT और MPT course में ये सब चीजें पढ़ाई नहीं जाती जो आज के वेबिनार में मैं आपको पढ़ाने वाला हूँ. So disc herniation is this. This thinning is just the reduction of the space of the disc. Now there is disc degeneration with osteophyte formation. What is osteophyte? Osteophytes are the new bone formation. As we see a lot of cases of the knee joint osteoarthritis, there is new bone formation. Same as in the spine also, there is new bone formation due to the pressure, over pressure. And one more thing is that is sacralization. अभी आपको एक slide दिखाएंगे, उसमें sacralization आपको दिखाई देगा. Now, in this slide, we see the structure. This is L3 vertebra, this is L4 vertebra, this is L5 vertebra, and this is sacrum. So, this is the lateral view of the spine. Spine का lateral view है. The main thing is that I'm just going to explain about the listhesis. Listhesis, what is listhesis? That is very common in our day-to-day life. ये कोई भाई साहब जो इधर मार्क कर रहे हैं, कृपया लेफ्ट हो जाओ, जाओ के खाना पीना खा करके पिक्चर देखो मेरे दोस्त, यहाँ आपका काम नहीं है. Please don't do this marking. You just go and take your dinner, my dear friend. Why you are wasting your time and our time also? It's my request. So it's the lateral view in which we are able to see the listhesis. Listhesis क्या होता है? Listhesis is the displacement of the vertebral body. अभी जो बात मैं पहले कर रहा था वो डिस्क की बात कर रहा था. Now it is the लिस्ट बोनी पार्ट, जो हमारा ये बोनी स्ट्रक्चर है, इफ इट इज डिस्प्लेसिंग फ्रॉम इट्स ओरिजिनल पार्ट, फ्रॉम जो नॉर्मल हमारा स्ट्रक्चर है, if there is any displacement, that is known as listhesis. And my dear colleagues, my dear friends, by chiropractic adjustment, you are easily able to do the management of listhesis, whether it is anterior listhesis or posterior listhesis. If the vertebra is coming anterior, that is known as anterior listhesis. If the vertebra is coming posterior, that is known as posterior listhesis or retrolisthesis. See, in this structure, this L5 vertebra is displaced anteriorly. So we can say that there is anterior displacement of L5 vertebra on S1. This is sacrum 1. जो हमारी वर्टिब्रा आगे खसकेगी उसके नीचे वाली वर्टिब्रा के बारे में हम बात करेंगे. So if there is anterior displacement, do the proper assessment, and as per the assessment we are able to do the diagnosis, and we are able to do the management. This is the elaborated structure of the disc herniation. अलग अलग तरीके से disc herniation हो सकता है, और अगर disc herniation है, there will be nerve compression. One thing, my dear friend, we see and we used to listen that what is stenosis. We see a lot of cases that there are patient is having the lumbar canal stenosis, cervical canal stenosis. So what is basically stenosis? Stenosis is that this is the lumen, एंड इन बिटवीन दिस आवर नर्व इज पासिंग थ्रू. एक हमारा एक ल्यूमन है जिससे हमारी नर्व्स पास कर रही है. तो डिस्बल्ज क्या होता है? डिस्बल्ज में एक पार्ट हमारा डिस्प्लेस होता है एंड दैट इज कंप्रेसिंग द नर्व. सो पेशेंट में बी हैविंग द टिंगलिंग सेंसेशन, नमनेस और रेडिएशन इन वर्ड पार्ट. जिस पार्ट का हमारा नर्व कंप्रेस कर रहा है, there will be radiation in that part. That is known as radiculopathy. If the pain and symptom is originated and radiating from one part to another part, if there will be any compression in the cervical region, there will be radiation, there will be numbness or tingling sensation in the upper limb. If there will be any compression in the lumbar region, there will be tingling sensation, numbness, or whatever the symptom is that will goes to the affected nerve which is affecting. जो हमारा हमारी नर्व कंप्रेस कर रही है, जो हमारी नर्व में प्रॉब्लम है, उस नर्व में हमें साइन एंड सिम्टम, वी विल सी द साइन एंड सिम्टम इन दैट पर्टिकुलर नर्व. सो if the spinal stenosis की अगर मैं बात करूं, if we will talk about the spinal stenosis, there will be full compression from every side. When we will go in the Mumbai metro or Mumbai local train in the morning in the peak hour, then if everybody is rushing, then they are compressing you from each part. That is known as spinal canal stenosis. Canal stenosis. I am sitting in this room. If suddenly 400 people just enter to the room, they will compress me from each and every part. That is known as spinal canal stenosis. Varieties of disc herniation, there are different varieties of the disc herniation. Disc herniation अलग अलग पार्ट में herniate कर सकता है, anterior, posterior, central, as per the assessment, as per the chief complaint of the patient, we can find out कि किस जगह पे उसका compression है, किस जगह पे उसका problem है, and as per that we will able to do the management. So if you are doing the assessment and you are finding out and doing the things, you can write down on the paper what are the different things are there, and as per the assessment, if required, go for the MRI also. MRI is required. Just ask the patient to go for the MRI. यहाँ पे मैं एक बात इंपॉर्टेंट चीज कहना चाहता हूँ, वो ये कहना चाहता हूँ that don't rely your management on the report of MRI. Please, 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 if you want to become the advanced chiropractor, if you want to become the advanced therapist, advanced doctor, don't do the management as per the MRI report. Do the proper assessment. Here approx 416 people are there in this webinar right now, and if we will all go for the lumbar spine MRI, 90% people will have the disc bulge, 90% people will have the herniation. So without any chief complaint also, they will show that there is this bulge and this herniation. So never rely your treatment protocol on the MRI. Just correlate it with your assessment. Do the assessment that where is the exactly rotation is there, where the vertebra is rotating, and as per that do the proper treatment. There are so many patients are there in my clinical practice. They used to ask me that how sir why we are not getting the result by the medicine. We are taking a lot of medicine from past 6 months and we are not getting the result, and you are doing the management in 2 minutes, you are doing the management in 3 minutes, and we are getting the result. Why is it so? The reason is that if there will be any rotation in the vertebra, suppose I just bend my hand like this, I will have the pain and tingling sensation in my this hand, and I will take a lot and lot of medicine. I will take a lot of steroid, and I will get the result for 4 hours or 5 hours just to the effect of the medicine only. Unless and until I will do the correction of the problem, I will not get the result. Even I will go for any steroid, any injection. That is the reason the patient is going to the orthopedic surgeon. They are just giving the muscle relaxant. They are just giving the painkiller. They are giving the steroid, and at last they ask the patient to go for the surgery. And even after surgery, they are asking the patient for their revision surgeries are there. Why it is so? Because they are not treating the cause, the root cause. That should be treated first. That should be done first. Just I have a lot of meeting with the different doctors in many hospitals, in many conferences I used to go, and there I used to tell them that you are just cutting the disc, but what about the rotation of the vertebra? There is rotation, you have to correct that. And unless and until you are going to correct the vertebra, you are not getting the good result. The patient will come after 2 months, and in our physiotherapy clinic also we see a lot of patient after post operation of the lumbar spine, lumbar spine, cervical spine, they used to come with the different chief complaints. Okay. So this is the disc and nerve root relation. This is L5 transversing nerve root. This is the L4 vertebra. This is the L5 vertebra. This is the L5 vertebra. If there will be any disc bulge between L5 and S1, the L5 vertebra will compress and the patient will having the pain and symptom of the compressing nerve root. जो nerve root हमारी compress कर रही है उसमें ही पेशेंट को चीफ कंप्लेन आएगा. तो व्हेन वी आर डूइंग द असेसमेंट, जब हम क्लास बीपीटी सेकंड ईयर थर्ड ईयर में थे, वी आर डूइंग द प्रॉपर असेसमेंट. वी आर टेकिंग द फैमिली हिस्ट्री, वी आर टेकिंग द current history, what is the acute phase, what is chronic phase, the structure of the patient, the rotation, everything we are documenting it. It is very important to do the assessment first. And next slide, we are going to know about the different compression. Agar we spine में अगर compression है, we don't require any MRI, we don't require any X-ray. Just go for the proper assessment and do the treatment. If you talk about me and good therapist, we used to go for the proper assessment, and after that we do the proper treatment of the patient. If the patient is not getting relief in 2 chiropractic sessions, then there will be a red light in my mind. There will be a red alert. Why the patient is not getting relief? Just we recommend the patient to go for the MRI also. ये मेरे साथ 2 बार ऐसा हो चुका. एक बार ऐसा हुआ कि एक पेशेंट मेरे पास में आया था जिसका हैड डन द प्रॉपर असेसमेंट एंड आई हैड डन द ट्रीटमेंट ऑफ द सर्वाइकल स्पाइन, एंड आफ्टर 2 manipulation the patient is saying that when we you are doing the thrust, and that after 10 minutes we are getting the relief, but after 10 minutes the patient is increasing, and in the night the pain is increasing more. So there is red light in my mind that I had done the 2 chiropractic adjustment and the patient is not getting relief. So I just asked the patient to go for the immediate MRI. Then after MRI, there will be the finding of the quad equinus, quad equinus syndrome. So I just referred the patient for the surgery. So it's not like that every patient you have to do the chiropractic. No, if the patient required the surgery, just refer the case for the surgery. Just like quad equinus syndrome, just like tumor, any tuberculosis case, any cancerous patient, any cervical myelopathy, just refer the patient to the surgeon. Sir, this is your case. Please go and enjoy. Whatever case we have, we will do, and we will do the best measurement. And in our daily clinical practice, I used to prevent a lot of surgeries. The patient, unnecessary surgeries are also going there. So we used to prevent the unnecessary surgeries. If we talk about the frequency, there is lumbar disc herniation that is 15 times more common than the cervical disc herniation. Why? Because we do a lot of work from our lumbar spine. Lumbar spine takes the load of our whole body. Whole body का हमारा जो load जा रहा है वो हमारे lumbar spine पे बहुत ज़्यादा जा रहा है. And percentage की अगर हम बात करें, there is more percentage of the disc bulge or disc herniation cases between L4 and L5. Even the patient used to call, sir, I have disc bulge between L4, L5, C4, C5. Why? That vertebra is more movable. There is more movement in that particular vertebra. L4, L5 is more movable vertebra. So if I will give the more movement on this wall, it will damage. तो जिस wall पे जहाँ पे ज्यादा movement होगा वहां पे इंजुरी के चांसेस बहुत ज्यादा रहेंगे. सो L4, L5 vertebra and C4, C5 vertebra, there is chances of more disc bulge. Oh, good slide. This is very important slide, and we are seeing the X-ray. This is lateral view of the lumbar spine, in which we can see this is the sacrum, this is the L5 vertebra, this is L4 vertebra, this is L3 vertebra, this is L2. There is reduced space between L1, L2 and L2, L3. So there may be chances of the disc bulge between L2, L3. As per the assessment, we will find whether there is nerve root is compressing or not, and as per that we'll do the treatment. We can see here there is osteophyte formation also. So there is lot of pressure between the L4, L5 vertebra and L5 and S1 vertebra. There is reduced space between L5 and S1. There we see a lot of cases in which there is sacralization of L5 vertebra on S1. What is that? That is basically fusion of L5 vertebra on S1. It means that we are getting a lot of pressure on L5 vertebra that is fusing to the S1 vertebra. In obese patient, जो मोटे patient है, and the patient who are less mobile, who are not doing the proper exercise, who are not doing the proper movement of the spine, they are getting the sacralization of L5 and S1. There will be fusion. And we see a lot of cases just like ankylosing spondylosis cases. In that cases, there is HLA-B27 positive, and there will be the fusion of the vertebra. In this case, there is increased lumbar lordosis also, and we can see here the spasm is also there. So there is a spasm in the paravertebral region, paravertebral muscles. This is the case of cervical spine, in which we are seeing the decreased cervical लॉर्डोसिस, जो हमारे नॉर्मल सर्वाइकल लॉर्डोसिस होनी चाहिए, उससे भी ये कम हो गया. व्हाई इट इज सो? ड्यू टू द ओवर प्रेशर, ड्यू टू द सीवियर स्पाज्म इन द सर्वाइकल स्पाइन, ड्यू टू द प्रोलॉन्ग अनट्रीटेड सर्वाइकल स्पाइन, द स्पाइन इज गोइंग बैकवर्ड टू द अपोजिट डायरेक्शन. सो द नॉर्मल जो हमारे सर्वाइकल स्पाइन का कर्वेचर होना चाहिए वो डिस्टर्ब हो गया, और जिसकी वजह से देयर इज लिस्थेसिस ऑल्सो. नाउ जो मैं इतनी देर से बात कर रहा था वो स्लाइड अभी आई, जिसमें मायोटोम्स की बात करी जाती है. मायोटोम्स, व्हाट इज मायोटोम? मायोटोम्स का मतलब है कि हमारी जो नर्व कंप्रेस कर रही है, द नर्व इज कंप्रेसिंग, दैट वी गेट द साइन एंड सिम्टम ऑफ द पर्टिकुलर नर्व रूट विच इज कंप्रेसिंग. जस्ट लाइक अगर मैं फैन का स्विच दबाऊंगा तो फैन चलेगा, लाइट का स्विच दबाऊंगा तो लाइट जलेगी. इसी तरीके से हमारी जो स्पाइनल कॉर्ड में वर्टिब्रास हैं, उसमें अगर कंप्रेशन है तो मायोटोम्स का ये एक चार्ट आप उस पे गूगल पे डालेंगे, मायोटोम्स, एंड जस्ट टेक द प्रिंट ऑफ दिस चार्ट एंड पुट इट ऑन योर क्लिनिकल प्रैक्टिस clinic, and we can see whether this patient is complaining of the pain, and there will be the back pain in the lumbar area, as well as he will complain that there is pain in the calf region. जो हमारा इधर बाहर की तरफ है, लेटरल साइड, मीडियल साइड, कहाँ पे पेन है, कहाँ पे टिंगलिंग सेंसेशन है, एज पर दैट वी कैन रूल आउट कि हाँ पेशेंट को इस जगह पे कंप्रेशन है, इस जगह पे उसको प्रॉब्लम हो रहा है. अब बारी आती है कायरोप्रैक्टिक की, कि क्या उसका रोल है, रोल ऑफ कायरोप्रैक्टिक और मैनुअल थेरेपी, एंड व्हाट इज मैनुअल थेरेपी, मैनिपुलेशन, उसका क्या रोल है आज की डेट में. पहले तो मैं बताना चाहता हूँ कि व्हाट इज कायरोप्रैक्टिक. कायरोप्रैक्टिक बेसिकली वी डू द एडजस्टमेंट ऑफ द बोनी पार्ट, दैट कैन बी स्पाइन, स्पाइन का भी हम एडजस्टमेंट करते हैं. वी डू द एडजस्टमेंट ऑफ द शोल्डर, वी डू द एडजस्टमेंट ऑफ द नी, वी डू द एडजस्टमेंट ऑफ द एंकल. हम पूरे बॉडी में बोनी पार्ट का अगर एडजस्टमेंट करते हैं, दैट इज नोन एज कायरोप्रैक्टिक. बेसिकली जो हमारी प्रॉपर बायोमैकेनिक है, बायोमैकेनिक स्ट्रक्चर है, अगर वो बायोमैकेनिकल फॉल्ट में जाता है तो देयर विल बी some problem in our body. We have to find out that fault, and as per that fault we have to do the proper treatment, proper adjustment. The difference between कायरोप्रैक्टिक एंड ऑस्टोपैथी इज दैट ऑस्टोपैथी में हम सॉफ्ट स्ट्रक्चर का एडजस्टमेंट करते हैं, जैसे हमारे विसरल ऑर्गन्स हैं. इन कायरोप्रैक्टिक वी डू द एडजस्टमेंट ऑफ द हार्ड स्ट्रक्चर, दैट इज द बोनी लेवल, बोनी लेवल का हम एडजस्टमेंट करते हैं. सो बाय कायरोप्रैक्टिक वी कैन डू द प्रॉपर एडजस्टमेंट ऑफ द स्पाइन, स्पाइन का हम प्रॉपर अलाइनमेंट कर सकते हैं, एडजस्टमेंट कर सकते हैं. एंड द गुड थिंग, आज ही एक क्लिनिक में मेरे एक पेशेंट मेरे से पूछ रहा था क्वेश्चन. द वन पेशेंट वाज आस्किंग मी, sir, whether you are giving the holistic measurement and you are doing the adjustment of the spine, can I get the adjustment for my wife? She is all right. Mega, yes, of course. As we do the adjustment of our car, wheelchair align, wheel alignment करते हैं कार में, वैसे हमारी बॉडी में भी अलाइनमेंट की बहुत जरूरत होती है. एवरीबडी हैज सम डिस्टर्बेंस इन द स्पाइन, वी हैव टू डू द प्रॉपर एडजस्टमेंट. प्रॉपर एडजस्टमेंट करेंगे, करेक्टिव करेंगे, तो देयर विल बी, वी गेट ए लॉट ऑफ डिजीजेस कैन बी क्योर्ड बाय जस्ट ट्रीटिंग द स्पाइन. स्पाइन को अगर हम ट्रीट करें तो बहुत ढेर सारी ऐसी बीमारियां हैं जिनका हम इजिली मैनेज कर सकते हैं. हेल्प टू इंक्रीज द रिड्यूस्ड स्पेस बिटवीन वर्टिब्रा by chiropractic adjustment. If there is any reduction in the joint space between the vertebrae, we can increase that space. That is very easily. Can manage the disc bulge and herniation cases? Yes, of course, we can do the management of the a lot of cases. For disc bulge and herniation, we can do the management, and we can prevent the unnecessary surgeries which are going on. So we can prevent unnecessary surgeries. Just find out the proper assessment. If the patient is, there is any red alert, then refer the case, or just you can do the treatment. अभी हमारे पास में इतने पेशेंट हैं जिनकी सर्जरीज रुक गई, और इफ द देयर इज एनी ब्लैडर एंड बॉवल इन्वॉल्वमेंट, then we refer the case for the surgery, or by chiropractic adjustment, if there is not bladder and bowel involvement, we do the management. Very big role in the case of spinal listhesis. There is any listhesis, I had already explained, we can do the management. We can do the management of spinal rotation. Yes, all the disc bulge of the herniation are just due to the rotation in the spine. So we can do the management easily. This slide is the gist of my workshop, my webinar, that before going for chiropractic adjustment, what you have to do. It's my request. In every workshop, I used to warn everybody, don't do the unnecessary chiropractic adjustment. If the patient is required, then only do the assessment. If you do the unnecessary thrust, unnecessary chiropractic adjustment, the patient will become in the problem. Because if there is stability, you are just moving the stability को आप खराब कर रहे हैं. So before going for the chiropractic adjustment, proper assessment is very necessary. Go for the general health of the patient, how the patient is having the general health, what is his past history, past medical history. उसका कुछ प्रॉब्लम ऐसा तो नहीं है, मेजर सर्जिकल हिस्ट्री तो नहीं है. If there is any surgical history, don't go for the chiropractic adjustment. If there is any cancer, don't go for the chiropractic adjustment. If there is spinal tumor, don't go for the chiropractic adjustment. So if there is any history of sudden weight loss, here it is written as weight loss, sudden weight loss. If clinical feature of spinal tuberculosis, if the patient is coming with the chief complaint of sudden weight loss, night sweating, and letharginess, and there is severe pain in the low back region, that may be localized or that may be radiculopathy. There may be radiculopathy. Then ask the patient whether you had gone through any medication in the past years. If yes, I am having the ATT. So never do the adjustment. Even don't do any kind of therapy, whether you are doing cupping therapy, dry needle therapy, physiotherapy, exercise therapy. Please, my dear friend, in spinal tumor cases, tuberculosis cases, just refer the patient, because if you will do the therapy, it will increase the blood flow, and whatever the infection is there, it will channelize out in the whole body. Whole body में हमारे channelize हो जाएगा. History of sneeze इसके साथ नहीं मिल रहा है. Then there will be history of prolonged steroid. If the patient is on prolonged steroid, there may be chances of getting weak bone. Bone की density हमारी कमजोर हो सकती है prolonged steroid लेने की वजह से. Just as rheumatoid arthritis का केस है, कैंसर का केस है, उसमें क्या होगा, bone weakness होगी. And if you go for the thrust, if you go for the manipulation, there may be chances of getting फ्रैक्चर होने के चांसेस बहुत ज्यादा रहते हैं. न्यूरोलॉजिकल साइंस को हमें देखना पड़ेगा, कौन से न्यूरोलॉजिकल साइन एंड सिम्टम आर प्रेजेंट. दिस इज VBI साइन, दैट इज वेस्टिबुलोबैसिलर इनसफिशिएंसी टेस्ट होता है. व्हेन वी गो फॉर द chiropractic adjustment of the cervical spine, we have to be very careful for the cervical spine manipulation. And before applying the cervical spine manipulation, there are some physical tests that is very necessary, which I used to teach in my workshop में बहुत डिटेल में मैं पढ़ाता हूँ कि कौन से फिजिकल एग्जामिनेशन करने हैं, कौन से टेस्ट हमें करने हैं बिफोर अप्लाइंग टू द chiropractic adjustment for cervical spine. There are many examination for cervical spine manipulation, but this test is very important. जो हमारे VBI sign है, that is very 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 important. Don't become hero for manipulation on the cervical spine. लोग बहुत हीरो बन जाते हैं कि फटाफट एडजस्टमेंट करें. No, cervical spine is very dangerous for the patient view as far as the therapist view. A lot of complication we see that comes due to the wrong manipulation in the cervical spine. There is compression of the VBI artery, the patient will become, there will be stroke to the patient. Stroke हो सकता है, hemiplegia हो सकता है, paraplegia हो सकता है, even there may be death also. पटना में अभी एक केस हुआ है जिसमें डेथ हो गया पेशेंट को. A lot of cases we see now in our newspaper that after chiropractic adjustment the patient become on bed. Bangalore also, last week I'd seen one newspaper cutting that there is some wrong thrust given to the neck and the patient is on ventilator. So my dear friend, before going for the chiropractic adjustment of the neck region especially, do the proper assessment. जब आप हमारे वर्कशॉप ज्वाइन करेंगे उसमें आई विल डिटेल में मैं बताऊंगा कि कैसे हम असेसमेंट करते हैं, कैसे VBI टेस्ट करते हैं, और कैसे वी कैन डू द सेफ chiropractic adjustment फॉर द नेक रीजन. ये जो हमारा वेबिनार है इसमें या मेरी जो क्लास है, आई एम नॉट टारगेटिंग दैट डोंट डू द chiropractic adjustment. Yes, please do the chiropractic adjustment. That is why this workshop is having this, that is why this webinar is having. And in daily practice we do a lot of chiropractic, but do the safe and correct chiropractic adjustment. That is only my request. Then physical examination we had already completed. Now We will talk about the precautions in osteoporosis cases. If there is bone density weakness is there, when we see a lot of cases for male above 65 year and female above 55 year, because 55 year or 50 year there will be menopause होने की वजह से bone का density कमजोर होता है, body में weakness बहुत होता है, there may be chances of weak bones. उस केस में भी हमें बहुत careful रहना चाहिए. यहाँ पे एक पार्ट बहुत इंपॉर्टेंट है टू नोट डाउन दैट इफ देयर इज रिटन इन द बुक इन द थ्योरी that don't do the chiropractic adjustment above 65 or above 55 year old of female, that is doesn't mean that you don't apply the chiropractic adjustment. Sir, madam, you have to do the proper assessment. It depends upon the पर्सन टू पर्सन. जो हमारा पर्टिकुलर पेशेंट है उस पर बहुत चीजें डिपेंड करती है. उसका बॉडी स्ट्रक्चर कैसा है, उसका बॉडी का हेल्थ कैसा है, उसका न्यूट्रिशन कैसा है. कई बार ऐसा होता है कि वी सी ए लॉट ऑफ केसेस हु आर हैविंग मोर एज. 65-year-old patient is there, but they are physically fit, they are their body is very strong, their bone is strong, and they are their structure is very good, so we can go for the chiropractic adjustment. And I'm just sharing, I had already done the chiropractic adjustment for 90-year-old man also. Even I had done the thrust for neck region, even I had done the thrust for lumbar region. So it depends upon the body structure and how we are doing the palpation के साथ में हमें समझ में आता है कि कितना thrust अप्लाई करना है, कहाँ अप्लाई करना है और कैसे अप्लाई करना है. Next part is pregnancy. So a lot of question is there, sir. Can we know we can't do the chiropractic adjustment in pregnancy? No, isn't like that. You can't do the chiropractic adjustment in pregnancy. We in pregnancy the lumbosacral area that is contraindicated for manipulation. We can do the adjustment in the wrist. We can do the adjustment in the knee. We can do the adjustment in the neck region. If the patient is having the ankle sprain or any problem in the ankle, go for the adjustment. And as far as the pain, low back pain cases are concerned in pregnancy, we see a lot of cases. Then don't go for the chiropractic adjustment, but do the proper assessment. That is very necessary. And as per the assessment, we can do the mobilization. You will get the same result by doing the mobilization and manipulation. The difference is that in manipulation we apply the thrust, and in mobilization we just mobilize the vertebra. So if you are seeing the lot of pregnancy cases, do the proper assessment and do the proper positioning. Positioning से भी हमें पेशेंट को हम ट्रीट कर सकते हैं. इवन मेरी वाइफ को प्रेगनेंसी में बहुत ज्यादा लो बैक पेन था, तो आई यूज टू डू द प्रॉपर पोजिशनिंग विद द पिलो. I used to do the proper mobilization, and after that she get relieved. So we see a lot of cases with the pregnancy. In pregnancy, you can go for the proper assessment and you can go for the mobilization. That is very, very easy and patient will get relief. Next point is hypermobility. In hypermobility is that there is increased mobility. So if you will go for the manipulation, then there may be chances of getting injured. So please don't do that. The most important slide, contraindication, that is bone weakness. Never go for the chiropractic adjustment if there is weak bone. In tumors, if there will be any spinal tumor, that is totally red flag. Don't be hero. Refer the case. Metabolic bone disease, refer the case. Tuberculosis, oh my God. Don't touch the patient, even don't do the physiotherapy also. Just refer the patient and say to the surgeon, sir, this is your case. Enjoy it. सर्वाइकल माइलोपैथी. माइलोपैथी क्या होता है? बेसिकली माइलोपैथी there is inflammation in the spinal cord. There is inflammation in the spinal cord. So also in that case also, don't do any chiropractic adjustment. Just refer the case. Last point is psychological. We see a lot of cases in our daily practice that they are not comfortable with the chiropractic adjustment. So it's very necessary to get the consult of the patient. Consult is very necessary. If the patient is not comfortable, if the patient is not ready for the chiropractic adjustment, just don't do the chiropractic adjustment. Go for the cupping therapy, go for triangular therapy or whatever you want. बिकॉज अगर पेशेंट को फियर है बहुत ज्यादा कैरोप्रैक्टिक एडजस्टमेंट से और पेशेंट कंफर्टेबल नहीं है, उस केस में अगर आप कैरोप्रैक्टिक एडजस्टमेंट करते हैं, देयर में भी चांसेस ऑफ गेटिंग इंजर्ड, बिकॉज वो अपनी बॉडी को ऐसे सिकोड़ करके रखेगा. देयर में भी चांसेस ऑफ गेटिंग स्पार्क. कई बार ऐसा होता है when we do the adjustment of the thoracic spine, the patient is not relaxing full body and there we are getting the spasm in the thoracic region. So it is advisable to ask your patient that be relaxed and be comfortable when you are going for the chiropractic adjustment, and breathe in and breathe out. That is very necessary. Importance of breathing is very big importance of breathing in your that chiropractic adjustment. Whatever adjustment you are doing, just go for ask the patient to breathe in and breathe out. At the phase of breathe out, shake. We will answer your query after completing the session. Don't worry. Just after the breathe out session, apply the thrust. Okay. Adnan sir, we will cover the question in the last, na?
Yes, sir. Yes, sir.
Okay, okay. So again, red flag, that is cervical myelopathy. Dislocation, yes. If there is any dislocation also, don't be hero, just refer the patient. In our advanced chiropractic, we do the adjustment for the dislocation also, but at your level, I'm not going to advise you to go for the adjustment for the dislocation. That is a part of orthopedic surgeon. In fracture cases, just refer the patient. Don't do any kind of therapy. Then there will be upper cervical ligamentous instability. In our cervical spine, there are different ligaments. If that is not stable and you are applying the thrust, then there may be chances of getting injured. Patient को injury हो सकती है, nerve compress कर सकता है. So देयर इज फिजिकल एग्जामिनेशन कैसे टेस्ट करते हैं वो मैं अपने वर्कशॉप में बताऊंगा आपको. कर सकते हैं कि सर्वाइकल स्पाइन का हमारा लिगामेंट कितना स्ट्रॉन्ग इनफ है टू गेट दैट फोर्स और नॉट, दैट इज वेरी इंपॉर्टेंट. वो हम देखेंगे, उसके हिसाब से ही हम एडजस्टमेंट करते हैं. क्वाड्राइकोना सिंड्रोम, जस्ट रिफर द पेशेंट. पॉसिबल कैंसर बता ही चुका हूँ. पॉसिबल इन्फेक्शन, इफ देयर इज इन्फेक्शन जस्ट रिफर द केस. इन्फ्लामेटरी डिसऑर्डर, अगर इन्फ्लामेटरी डिसऑर्डर है देन ऑल्सो just refer the case. There are different technique. In our workshop, we used to teach 4 to 5 or 6, 7 techniques for each compartment, cervical spine, thoracic spine और lumbar spine में कैसे हम एडजस्टमेंट कर सकते हैं एंड क्या क्या मेथड होते हैं एडजस्टमेंट के, और किस तरीके से इजी वे में हम एडजस्टमेंट कर सकते हैं. आई विल टीच दैट. दिस इज द सर्वाइकल स्पाइन मैनिपुलेशन. C0 C1 मैनिपुलेशन इज देयर. And for your kind information, the upper cervical spine, that is C1 C2, that is very dangerous to do the adjustment. So do the proper alignment assessment and then do the treatment. The upper cervical spine, that is mainly recommended for the migraine, for the upper cervical spine instability. There will be radiation in the hand and there may be migraine and cervicogenic headache. The patient is complaining of the headache which is originating from the neck region and going up to the head. That due to the compression in the C2 vertebra. This is cervicothoracic junction. We used to do the management. That is very easily. We see a lot of cases जिनको due to the overuse of mobile, due to the overuse of laptop, there is pain in the upper thoracic region and lower cervical region. That is known as cervicothoracic junction. The junction between cervical spine and thoracic spine. So we can do the management and we can treat the hump. If there is any hump in the cervicothoracic region, we can use this technique. This is the basically manipulation of the thoracic 2 vertebra and the patient will get relief in 1 session or 2 session. This is the adjustment in the sitting position. Cervicothoracic junction, we see a lot of cases who are having the pain. This is the technique, very useful technique for upper thoracic pain and lower thoracic pain. This is basically for the facet joint opening because the thoracic spine is basically meant for the stability, less of mobility, where there is less mobility in the thoracic spine and more of the stability. There are visceral organs. Visceral organs हमारे इधर हैं, उसको वो प्रोटेक्ट कर रहा है. इस वजह से हमारे जो thoracic spine है उसमें मोबिलिटी बहुत कम रहती है. This is the butterfly technique, in which also we do the proper assessment and do the treatment for the facet joint. There is locking of the facet joint in the thoracic region. The patient position will be in the prone line position. The therapist will stand towards the side of the patient. Elbow should be straight. We will apply the thrust from this hand to this direction, from this hand to another direction. There will be opening. That's why it is known as butterfly method. Prone thoracic sphere technique. In this also we do the that can be done from this up to down or from down to up. This is also for the facet joint opening. Now lumbar roll manipulation. This is a very easy technique for the lumbar spine manipulation. ये सारा हम आपको जब workshop रहेगा उसमें practical करके दिखाएंगे. We will do the practical, live practical, how to do the lumbar spine manipulation. There is one, this is a one technique, only one technique, in which the therapist will stand towards the face of the patient. The patient is in sideline position. Upper limb will be bent to the knee level. This is my upper, this is my right hand, which is on lumbosacral junction. This hand is on thoracolumbar junction. We'll do the rotation and then we will apply the thrust. There will be opening of the vertebra. There are two kind of lumbar roll manipulation. One is specific and one is general lumbar roll manipulation. General roll manipulation we can apply to any patient. Specific lumbar roll manipulation is for the particular patient whether nerve compression. Then reverse lumbar roll manipulation and modified lumbar roll manipulation. There are different techniques. This is kick start method, which is very useful by the lean and thin patient and heavy lean and thin therapist and heavy patient. In our daily practice, we see a lot of patients who are very overweighted and the therapist is lean and thin. So we can apply this technique. Case study. In this, we are seeing the MRI report of one of the patient who is having the straightening of the cervical spine. We can see there is decreased cervical spine lordotic curvature. There is increased kyphotic posture इधर बढ़ा हुआ है. There is hump over the cervicothoracic region. एक हमारा इधर spasm भी बना हुआ है. There is spasm also there. And this bulge between L4, L5 and L5S1 region में this bulge हो रखा है. So we have to work more on the cervical spine. We have to work on the thoracic spine and as well as we have to work on the lumbar spine also. We have to correct the posture of the patient. We have to do the adjustment of the C2 vertebra, then thoracic region, cervicothoracic region, and there is disc bulge. So we have to correct the disc bulge also. This is the X-ray of lumbosacral region, in which this is the AP view, in which we are seeing the scoliosis of this patient. There is slight scoliosis. Op angle is basically done for the measurement of the scoliosis. We see this pelvic is going up, this pelvic is going down. So there is rotation in this pelvic. Maybe there is posterior rotation in this leg. There is sacroiliitis. We are seeing the sacroiliitis. So there may be history of prolonged sitting of this patient. Sacroiliitis का केस है जिसमें ये हमारे स्क्लोसिस भी दिख रहा है और रोटेशन भी दिख रहा है. This is the case study 3, in which the X-ray, this is the lateral view. We are seeing the reduced joint space also. We are seeing the osteophyte formation and there is fusion of the bone. So it's very necessary to rule out if there is more fusion. Don't go for the chiropractic adjustment. Nowadays, I'm not going to take the name, but there is a lot of famous chiropractor also. They are doing the chiropractic adjustment in the ankylosing spondylosis cases. So if request to you, if there is any fusion, hard structure is there, there is fusion, then it is not advisable to go for the chiropractic adjustment. Go for the mobilization and go for the exercises. Case study 3. This is also one of the most important case I had seen in my life. Whatever I am showing you, these all are my cases. So thanks to my dear friend who had just marked here, blue line. Here is, you can see how the disc is coming out. Whole structure of the disc is coming out and there is severe nerve compression. This is the clear-cut case of Coda Aquina syndrome, जिसमें patient को bladder and bowel is involved there. So just refer the case for the chiropractic for surgery. Don't do chiropractic adjustment. This is the case study 5, in which we are seeing the straightening of the spine. There is slight anterior listhesis also, and there is reduced joint space. So there may be chances of disbulge. Ask the patient to go for the MRI, and after MRI, we can able to treat the patient. This is case study 6, and I think this is the last case in which there is severe compression, and we can see there is inflammation of the spinal cord. So this is the case of cervical myelopathy, in which chiropractic is totally contraindicated. Never do the chiropractic adjustment. Just refer the case. Now, yes, after chiropractic adjustment, we can go for some therapies. For another therapies, just like cupping therapy, we can go for the dry needle therapy. We can go for the hot pack. Hot pack हम लगा सकते हैं. Cupping therapy, in which we can do the opposite suction हम करते हैं, और we can release the spasm of the muscle. Muscular जो spasm है, उसको हम easy way में खत्म कर सकते हैं. What is spasm? Spasm is involuntary contraction of the muscle. Muscle का जो involuntary contraction है, that is known as spasm. This is dynamic cupping, which can be done in the listhesis of the spine. Spine के listhesis के case में हम dynamic cupping कर सकते हैं. After chiropractic adjustment, we can go for the cupping therapy. After, we can go for the dry needle therapy. We can go for the physiotherapy. We can go for ice therapy, heat therapy. You can apply. This is hijama, which is used in the PIVD cases. Dry needle in spinal canal stenosis, we use it. Taping is very important. Why taping is important? Because I used to do the adjustment. I had done the fine adjustment, but when the patient goes to the home, they can do the different bad posture they have. They can lift the weight, or there may be any rotation. So again, there may be disbulge. 2-3 cases मेरे साथ ऐसा हो चुका है. There was one case, he is having the severe neck pain. I had done the good adjustment, and I had asked the patient to go for the walk. He was very fine. And in the evening, he is calling me. Another day, he is saying he is coming to the clinic with a complaint that he is again having the pain, and there is severe pain. So I had asked him that what you had done. He said, no, I had not done. Then I just asked her wife that I had done the good adjustment, even then why he is having pain. Then she told me that after going from the clinic, there was the IPL session was going on, and he was just continuously watching the TV and using the mobile and lying down on the sofa for 3 hours. Then I asked the patient that what you are doing, man? I had done the good adjustment, and you are not doing the proper care of your neck. Then again the pain will come up. So taping plays a very big role. By taping, we can reduce the spasm, we can reduce the swelling, we can increase the blood flow also. This is differential diagnosis. Sacroiliitis, sacroiliac joint, the joint between sacrum and ilium, that is known as sacroiliitis, sacroiliac joint, and there may be rotation in the pelvic. We have to rule it out and do the proper treatment. Pattern of SI joint pain in specific location. The patient complains that he or she is having the pain in particular region. Sitting will increase the pain. After sitting, there will be increase in the pain. Difficulty in sleeping, the patient will have the difficulty in sleeping. Common SI joint syndrome में क्या रहता है? There will be below L5 region, sensation in lower extremity, pain, numbness, tingling sensation हो सकता है, pelvic और buttock pain हो सकता है, hip groin pain हो सकता है, feeling of leg instability, disturbed sleep pattern due to pain, disturbed sitting pattern, ये सारे हमें chief complaint मिलते हैं. एंटीरियर रोटेशन डिसफंक्शन, उसमें क्या होगा? ये हमारा पेल्विक एंटीरियरली डिस्टर्ब हो रखा है. उसकी जैसे कि हमारे पास अगर प्रेगनेंसी का केसेस आता है, ओबीज पेशेंट आता है, उस केस में देयर विल बी एंटीरियर पेल्विक टिल्ट, एंटीरियर पेल्विक रोटेशन होता है, जिसमें देयर विल बी इंक्रीज लंबर लॉर्डोसिस. इंक्रीज लंबर लॉर्डोसिस होगा, देयर विल बी इंक्रीज लंबर लॉर्डोसिस. अगर कोई ओबीज पेशेंट है या प्रेगनेंसी है, उस केस को हमें करेक्ट करना चाहिए. देयर आर डिफरेंट मेथड, बहुत ढेर सारे मेथड है जिसको हम यूज करके पेल्विक के रोटेशन को करेक्ट कर सकते हैं. पोस्टीरियर रोटेशन डिसफंक्शन, अगर पोस्टीरियर पेल्विक जाएगा, देयर विल बी फ्लैट बैक, जैसे कि हमारे एंक्लोजिंग स्पॉन्डिलोसिस का केस होता है, उस केस में फ्लैट बैक होता है. और ये रिकमेंडेड है कि जहां पे पोस्टीरियर रोटेशन होगा, उस साइड का हमारा लेग में भी पेन आएगा, नी भी अफेक्टेड रहता है. थैंक यू सो मच, बहुत बहुत धन्यवाद आप सभी का. बिफोर एंडिंग द सेशन मैं आपको एक दो वीडियो दिखाना चाहता हूँ, और एक वीडियो आपको शेयर करना चाहता हूँ जिसमें हम देखेंगे कि कैसे हम हम्म, अपना वर्कशॉप लेते हैं या कैसे हम पढ़ाते हैं। एक वीडियो आपको दिखाना था। हम्म, ये हमारी क्लास चलती है जिसमें इट इज विजिबल, अभी दिखाई दे रहा है आपको? हेलो। हेलो एवरीवन, इज इट विजिबल? Adnan, is it is visible?
1 second, sir. Our video is not.
No, no.
Now it's visible.
Uh,
It's visible.
so it's might just a 1 minute video. I'm just ending the session. So it's a video in which patient position, sideline position, therapist standing towards the side of patient. Patient का जिधर फेस है उधर हमें खड़े होना है, अपोजिट साइड नहीं खड़े होना है। Affected limb should be up. एक एक चीज आपको
Sir,
बता।
it's not visible. Please again make it again. What is this guys and all? 1 second, sir. I will remove this guy.
Now is it visible, sir?
No, sir. No, again you do, sir.
Patient position, sideline position, therapist standing towards the side of patient. Patient का जिधर फेस है उधर हमें खड़े होना है,
It's
अपोजिट
just
साइड।
showing a screen, sir. The video is not coming.
Okay,
It's
no
just
issues, no
showing a
issues,
screen.
no issues. Video is not
Again.
coming. No issue. I will share the video in the group. No issues. If there is any query, you can ask me. Just add in the PPT. I
हाँ
want to show one or two video. I will share in the group. I just want to
guys.
say that we used to do the proper assessment in our workshop. एक एक पार्ट को मैं बताता हूँ कि कैसे असेसमेंट करना है, बिकॉज असेसमेंट इज वेरी नेसेसरी। देयर इज वन स्मार्ट स्टोरी। एक छोटी सी स्टोरी, 1 मिनट की स्टोरी है। एक बहुत रिच आदमी है अपने इंडिया में, बहुत महंगी गाड़ी लेकर गया, डेट कॉस्ट 220 करोड़ रुपीज की उसने कार खरीदी। वो गाड़ी स्टार्ट नहीं हो रहा था। देन ही आस्क्ड टू द मैकेनिक, दे आर डिमांडिंग 20 लाख रुपीज फ्रॉम द फॉरेन कंट्री। देन देयर इज ए इंडियन गाय, ही डिमांडेड 2 लाख रुपीज टू स्टार्ट द कार। But at last, that rich man asked him to start the car. He had demanded one hammer, and he done the assessment of the car, and he just put three hammer and asked the person to get start the car. After that, he was saying that, are you joking? He said, no, sir, I'm not joking. Just
Hello, Puneet sir. You can start now again. I just suspended all activities. Hello. Hello. Hello.
अभी वॉइस आ रहा है? हेलो, हेलो, वॉइस आ रहा है?
Yeah,
Anand sir,
yes.
are you getting my voice?
Yes, getting, sir. I was
Okay, thank you
continue.
so much. Thanks all of you for listening me patiently. Thanks all of you. Over to Dr. Adnan Sheikh for further things.
Now we'll have a question answers session, sir.
Okay, sir, no issues.
Now those who have questions and all, they can ask. They can mute themselves and they can ask questions.
Nobody wants to ask anything?
1 second, sir. 1 second. Now you can unmute yourself and you can ask the questions one by one. Hello. Hello.
Hello.
Start getting problem. Unmute yourself.
Yes, sir. What is the difference with the osteopathy?
I
I want to.
hello. What is the reason of call pen?
What is the reason of?
One by one.
Hello.
What is the
Reason.
One by one, please.
Okay, sir.
Puneet sir, it is Rajesh Tripathi. I want to know whether we can give the chiropractic in the case of secondary stenosis.
In the case of
Secondary stenosis.
secondary canal stenosis, yes, we can go for the
Yeah.
chiropractic adjustment that will increase the vertebral space and it will. Sir, have you got my point? Hello? Hello, Rajesh sir? Am I audible? मेरी वॉइस आ रही है?
Yeah, the people are making some chores. That's why it's getting a problem. Please ask one by one, so it will be beneficial for you guys. And please mute your background music. Anyone ask? Anyone want to ask question now? Hello.
Please ask my dear friend, whatever you want to ask. I am there to help you out, people.
1 second, sir. 1 second. Some problem is there, I think. That's why getting not getting voice.
Sir, good evening, sir. Hello.
Hello.
Yeah, able to hear me, sir?
Yes,
Sir, good evening,
now.
sir.
Yeah, sir. The question is,
Are
if
you able to hear me, sir?
patient is having on the left side, so the chiropractic adjustment should be done on the both side or the left side radiculopathy only left side, the lumbar spine.
Sir, you are not audible.
Now
Sir,
am I
at which
audible?
stage of osteoporosis we can use chiropractic?
Just a minute, sir.
सर
In osteoporosis, don't do the
सर ये रीढ़ की
chiropractic
हड्डी में
adjustment.
दर्द हुआ है तो क्या करें?
Go for just gentle mobilization. Okay.
सर ये रीढ़ की हड्डी में बड़ा दर्द है, इसे
Again,
Hi,
कैसे?
sir. This is Saddam. Can we do Cairo for grade 3 and grade 4 spondylolisthesis, sir?
in
अरे सर ये रीढ़ की
spondylolisthesis
हड्डी में
cases,
बहुत
do
दर्द
the
है, क्या
proper
करें?
assessment. We can do the adjustment and we can cure the case up to grade 3. And if there is more listhesis, grade 4 listhesis is there and severe compression is there, then surgery is
दवा बता दो
required.
यार.
So do the proper assessment. If there is severe compression, if the patient is having bladder and bowel involvement, refer the case for the surgery. In up to grade 3, we can do the treatment by chiropractic adjustment. Easily we can do the.
शेर.
What is the difference from chiropractic and osteopathy?
Thank
In
you, sir.
chiropractic, we do the proper adjustment of the bone. In osteopathy, we do the adjustment of the visceral organ. In osteopathy, we do the management. If the suppose if the patient is coming with the low back pain case, there may be chances of constipation may be there. So in osteopathy, we do the visceral management and we treat the constipation. After treating the constipation, patient get relief. In osteopathy,
Sir,
treatment of liver.
थर्ड से स्पेन का एक केस है B12 उसका
Sir,
एक्सरसाइज
myself,
मेडिसिन चल
Mika.
रहा है
एक
Hello.
one by
One
one,
by
please.
one by
Sir,
one, one by one.
myself,
हेलो
Mika. What is
सर
the role
सर
of Hizama
सर
therapy
थर्ड
in
से स्पेन का
PIBD?
केस है
PIBD
हेलो
basically
आर यू
If
hijama
you
गेटिंग
after
do
doing
any
the
kind of
hijama.
thing, you will be removed and your certificate will be hold. You will not get certificate. Whatever the glitch you are doing, it's getting recorded, and we are showing your name and ID in this one on screen. So kindly don't do behave like a professional. It's not like you don't look like a professionals.
My dear friend, I am
Hello,
here
good
to
evening, sir.
answer each and everyone. Don't
Hello,
worry. Don't be in
good
hurry.
evening, sir.
Good evening. Just somebody had Mika had asked me what
Uh,
is the role of
Sir,
hijama
I
in
have a
PIBD
question.
case.
Sir, I
Just
have a
wait,
question.
sir. Just a minute, sir. Let me complete that answer. In hijama, we do the detoxification of the body. So there will be any detoxification. Why we are getting the problem? Because there is toxic materials are there. There is lack of blood supply. There is hello. There is lack of blood supply and there is problem in the spine. So after doing the hijama, we remove that detox. We do the detoxification of the body and there will be increased blood flow and there will be natural healing of the body. Okay.
Thank you so much, sir.
Okay. Welcome. Next,
Sir,
please.
I
So
have a
can we
question.
perform Cairo in case of ankylosing spondylitis?
As already I had explained in my PPT, don't do the chiropractic adjustment for the ankylosing spondylosis cases because there is fusion of the vertebra. Their vertebra is already fused. And if you will apply the thrust, there may be chances of breakdown of the vertebra. There may be chances of getting fracture. Fracture होने के chances बहुत ज़्यादा हैं. इसलिए we can just go for the gentle mobilization technique, go for the stretching, go for the cupping therapy, go for the proper exercises of the patient and proper ergonomics correction and posture correction. That is only the solution in ankylosing spondylosis cases.
Yes, sir. Sir, I
Thank
have a
you, sir.
question.
Please, sir, ask me.
Sir, how to prevent hump?
Hump, you have to. Why hump is coming? That is due to the bad posture. What is the reason? The reason is bad posture. Just ask the patient to go for the correction of the posture, go for the strengthening exercises, go for the isometric exercises of the neck, ask the proper correction of the posture. There will be ask the patient to do the proper exercises of the neck. कोई पेशेंट अगर ऑफिस में बैठा है उसको 5 मिनट के बाद में आपको बोलना है कि प्रॉपर नेक की स्ट्रेचिंग करिए, प्रॉपर एक्सरसाइजेस करिए एंड गो फॉर दिस इज नोन एज नेक टू एक्सरसाइजेज होती है, दिस ये एक्सरसाइज है, ये आप करेंगे, जिस दैट कैन प्रिवेंट द हम्प, वी कैन इजिली प्रिवेंट द हम्प, प्रिवेंट कर सकते हैं, एंड गो फॉर द proper stretching of the neck and go for the hot fermentation to reduce the spasm which is coming out in your muscle. That is their main solution.
Puneet sir, it is
Sir,
Rajesh
sir,
Tripathi.
sir, excuse me, sir.
Puneet sir, it is Rajesh Tripathi.
Sir,
Yes, yes,
Sir, I
Rajesh
want
sir,
to know.
बोलिए.
मैं ये पूछना चाह रहा हूँ, क्रायो प्रैक्टिस के बाद मैंने देखा है कि काफी पेशेंट्स को ये जो पेन है वो रहता है, मतलब जो पेन है वो इंक्रीज कर जाता है. व्हाट डज इट मीन? एंड सेकंड थिंग ये है कि क्या हम क्रायो प्रैक्टिस के बाद वी कैन गो फॉर द इलेक्ट्रोथेरेपी और मॉडलिटीज?
यस सर. राजेश सर, एक्चुअली कई बार ऐसा होता है कि आफ्टर डूइंग द हेलो, जो हम थ्रस्ट अप्लाई कर रहे हैं उसका पेन पेशेंट को रह सकता है आफ्टर. हेलो सैयद जी, प्लीज म्यूट योर सेल्फ. So after the chiropractic adjustment, it is advisable to go for the electrotherapy. Yes, you can go for the hot pack fermentation. If you can go for the ice pack, that will increase the blood flow. It will reduce the pain and it will reduce the pain. So after chiropractic adjustment, go for the one thing. Said ji, please mute yourself. It's my
Are you
request
mad?
to you. Said ji, अपने आप को म्यूट करिए.
What is the name of that participant, sir? Name.
Said.
What is the reason of sciatica pain and treatment?
Sciatica pain. Sciatica is basically the nerve compression of the sciatic nerve. There may be rotation in the lumbar spine. You have to rule out what is the rotation, and as per the rotation, do the proper assessment, do the proper thrust, and you will get result.
Sir, if
Sir,
sciatica is in the
we
left
can do
side,
the
you have to do
repetition,
on the left side only.
repetition.
hello, sir.
Yes,
Hello,
sir.
sir.
One by one.
Sir, sciatica is, if it is in the left side, you should treat in the left side or do chiropractic on the both side.
Sir, there is basically in YouTube video, we see that everybody is doing the adjustment to the both side. That should not be done. YouTube University is the most dangerous university. Don't copy from YouTube. Just do the proper assessment. If there is rotation, if there is any vertebral rotation towards the right side, it is compressing the left side nerve. So we have to do the proper assessment and do the thrust on one side only. Which vertebra is affected and which nerve is compressing. Don't do towards the both side. That is advisable. Just do one side of the thrust.
So we are doing the chiropractic, sir, in repetition like one time per month, one time something.
Okay, good question, my dear friend. You can do the chiropractic adjustment twice a week.
YouTube पे चला रहा YouTube चला रहा YouTube चला के देख जल्दी.
Said ji, again you are disturbing. So it is advisable to go for twice a week, not more than twice a week. Generally, we used to do once a week or twice a week. That is all right. And rest of the days, you can go for the electrotherapy, you can go for the exercise therapy, you can go for the cupping, whatever you want.
बे चलना सुट्टा मार के आता है जल्दी चल.
Hello, sir. Shan Rahman this side.
Sir,
Is it sufficient
Sir,
for
I have a
me?
question.
सर मेरा एक क्वेश्चन है. एक पेशेंट है, लेडी पेशेंट है, फोर्स स्पाइन का केस है सर.
Hello, sir.
Hello, sir.
Are you hearing me, sir?
One by one, please. One by one, please. My
Sir,
Sir, if I joined the workshop, is it
मेरा एक
sufficient
क्वेश्चन है
for me
सर.
to perform Cairo on my clinical practice?
Sir, please repeat the question.
Hello.
Sir, please repeat the
सर
question.
आवाज आ रही है?
Hello.
हाँ, बोलिए बोलिए.
आवाज आ रही है सर?
आ रही है.
हाँ सर, ये मेरा क्वेश्चन ये है कि पेशेंट लेडी पेशेंट है, फोर्स स्पाइन का केस है. उनका मेडिसिन ऑलरेडी चल रहा है और पैराप्लेजिया हो गया है.
बहुत
एक
कम आवाज आ
महीना
रही है
से
आपकी.
आवाज आ रही है सर?
हाँ, बहुत कम आ रही है, लेकिन बोलिए बोलिए.
हाँ, एक महीना से उनका फिजियोथेरेपी में मैनुअल फिजियोथेरेपी उनका हो रहा है और हम इलेक्ट्रोथेरेपी का भी इस्तेमाल कर रहे हैं. ईएमएस मसल स्ट्रेटर दे रहे हैं, लेकिन उनका फ्लिकर कंट्रैक्शन भी अभी नहीं आया है. एक महीना इलाज करते हुए हो गया, तो उस केस में क्या कर सकते
उनका कोई एमआरआई वगैरह हो रखा है?
हैं? है ना सर?
हाँ ठीक है, मेरे नंबर पे मैसेज करेंगे, मेरा जो नंबर है इसमें ग्रुप में दिया हुआ है, उस पर मेरे को अगर जो भी रिपोर्ट है वो शेयर करेंगे, आई विल सॉल्व योर क्वेरी।
Cerebral palsy patient, we can do that chiropractic. And sir, you can just send that some videos. We can see that.
I will send the video. Just repeat the question.
Cerebral palsy, we can do the
No.
chiropractic.
Cerebral palsy in the children, don't go for the chiropractic adjustment. You can do the manual therapy. You can do the mobilization of the knee joint, which is affected for the shoulder. But in children below 14 year, don't go for the chiropractic adjustment, because there is the stage of growing. Growing stage. So there may be chances of getting injured. There may be
Sir, can
chances
we
of
leave
meniscus fracture.
if we don't have any doubt?
Hello, sir.
Sir, बोलिए.
Can you hear me, sir?
Yes.
Sir, I have a small doubt.
Please,
Hello.
बोलिए.
Yeah. Sir, I have more interest in Cairo, sir. But so most of the people are saying the chiropractic is a temporary relief only. Like that, they are saying. It's. I'm just asking, sir. It's. Can you
My
suggest?
dear friend, after chiropractic adjustment, their proper posture correction is required, proper exercise is required. Suppose मैं आपके, you understand Hindi or English?
English, sir. English is
English.
comfortable.
Suppose I used to come to your clinic having the neck pain. You had done the proper adjustment for my neck, and after that my posture is wrong. I am not caring about my neck. I am doing the wrong thing. I am using 8 hours of the laptop. I am using the mobile phone. Then again I will complain with the pain. So after chiropractic adjustment, ask the patient to do the proper exercise, correction of the posture. That is very necessary. If he will not follow your instruction, again he will come to your clinic with the same pain. So it's not like that I had done the proper chiropractic adjustment for your spine one time and you will be okay for lifelong. It is not like that. Just explain the patient.
Hello.
There
We can
Can you
attend the
explain?
chiropractic.
Hello sir,
Hello.
सर मैं यासीन बोल रहा हूँ.
बोलिए.
हेलो सर, हमारे एक पेशेंट है होम विजिट पे, जीबीएस सिंड्रोम. सर मैं उनको 3 से 4 मंथ एक्सरसाइज करा रहा हूँ. 0 ग्रेड मूवमेंट था. आज वो सिटिंग कर पा रही हैं, बट सर कुछ खास रिस्पॉन्स नहीं आ रहा है. 4 मंथ हो गया समथिंग.
हाँ.
ये कृष्णा नगर में सर.
उस केस में देयर इज वीकनेस इन द बोन की वीकनेस, अरे वीकनेस ऑफ द मस्कुलर का वीकनेस है जीबीएस सिंड्रोम में. गो फॉर द आइसोमेट्रिक एक्सरसाइजेस, वेट बीटिंग एक्सरसाइजेस एंड इलेक्ट्रिकल स्टिमुलेशन. कायरोप्रैक्टिक इज नॉट रिकमेंडेड इन दैट केस. जस्ट गो फॉर द मसल स्टिमुलेशन आप करिए, मसल्स की स्ट्रेंथनिंग एक्सरसाइजेस कराइए और वेट बीटिंग एक्सरसाइजेस कराइए. दैट इज वेरी
बट
नेसेसरी.
सर अभी 0 ग्रेड मूवमेंट.
0 ग्रेड मूवमेंट है तो उसमें भी आप पैसिव एक्सरसाइजेस करिए, स्ट्रेचिंग करिए और यू कैन गो फॉर इलेक्ट्रिकल स्टिमुलेशन. इलेक्ट्रिकल स्टिमुलेशन दे सकते हैं.
Sir, can you hear me?
Sir, we
Share
can
this
do the
PPT.
2-day
Sir, can you
workshops
hear
like
me?
sir.
Hello.
Sir, please can you share this PPT on the group?
Yes, I will share the PPT.
Oh, okay, sir. Please share this.
What are the physiological effects of chiropractic adjustment?
By doing the chiropractic adjustment, the physiological effect is that when there is adjustment, there will be the proper correction of the vertebra. There is increased space between the vertebra. जब space अच्छा होगा, there will be increased blood flow and everything will be corrected. There will be healing. Proper natural healing of the body will be there. That is the physiological effect of chiropractic.
Sir,
Sir,
under
can you hear me?
So we can do the chiropractic, sir. How many days we can get, sir, chiropractic?
Sir, one by one, please, one by one. I am not able to understand what question you are
Is
asking.
it internationally certified?
Hello?
Yeah, I wanted to know, is it internationally certified?
Which thing, madam?
Is
Our
this
workshop
internationally
certificate?
certified?
Yes, we will give the certified certificate.
Internationally?
Internationally, go and work anywhere where you want to work.
Thank you.
Sir,
Well,
can you
Do
hear
the
me?
chiropractic, sir. How many days, sir, we can get the workshop, sir? We can attend that. How will do that, sir?
I will share the information about the workshop, upcoming workshop. We will share in the group.
Can we do it
And share
online?
the PPT too
I'm in
also, sir,
Saudi.
please.
I
I
can
will
do
share
it
the
online.
Ma'am, I am not getting your sentence. Please repeat, ma'am.
If I am in Saudi, I can do it online.
Online. Actually, see, we'll discuss basically some things are that we have to work offline only, because you have to do the proper adjustment, how we can do, how we can teach you. It's just like you are teaching me how to do swim in how to do the swimming, because I don't know swimming. From Saudi, can you teach me how to do the swimming? So there should be some practical things. So I can take the class online, but practical sessions are very necessary. You have to take time for 2 or 3 days at least to go for the practical session, man.
Sir, can you hear me?
Yes, please, sir.
Sir,
Abdul.
sir, what is
So I
drift
have a
velocity?
question. So I have a
एक एक
question
करके
about. So I have
बोलिए.
a question that you say in disc herniation we use chiropractic and it is beneficial. Then it is if it the sciatic nerve is compressed, then what about the treatment plan and all? Can you please explain, sir?
Sir, please join our upcoming workshop. I will explain each and everything. It is
Sir, if
not
disc is
possible for me
protruded and
to
bulged.
सर एक
share how
क्वेश्चन है
to do
सर.
the adjustment by sitting here on laptop. There are
Sir,
different techniques, my dear friend. Just listen to
sir,
me.
if disc
Sir,
is
sir, just
सर
basic
एक क्वेश्चन
knowledge
है.
of about the treatment and in the
Sir,
nerve compression.
yes, there are different techniques are there, how to do the assessment, and as per the assessment, we apply the technique. As I had already explained you that lumbar roll manipulation, you had seen that lumbar roll manipulation. That is the technique to treat the sciatica there. That is the technique that can, sorry, that can be used to treat this bulge and herniation in lumbar spine.
sir,
Sir,
a
sir,
common
what is
question
the
if a
सर
bulged
significance
disc
एक
of
will go
क्वेश्चन है
back
सर.
to
Am
the
I
original
audible to
position?
you?
हेलो.
If there is a protruded disc, will it go back to its
Sir,
position
if
back?
the disc is bulged.
Yes,
Hello, sir. Am I audible to you?
yes, yes.
Okay. Sir, can we do spinal correction in upper cross syndrome and lower cross syndrome?
Yes, but upper cross syndrome and lower cross syndrome is basically the imbalance of the muscle. So we have to do the proper alignment of the spine first. That is must required. That should be done first. You have to do the proper alignment of the spine, cervical spine, thoracic spine, and lumbar spine. Then go for the muscles. You have to work more on
sir?
जो
Sir, what
हमारे
is
मसल्स है
calorie
upper cross syndrome में
calorie?
बेसिकली जो हमारे स्पाइनल की मसल्स है, there is tightening of the spinal muscles and there is weakness of the abdominal muscles. So what you have to do, you have to go for the strengthening of the abdominal muscles. You have to go for the strengthening of the abdominal muscle and stretching and relaxing of the spinal muscles. जो हमारे spine की muscles हैं, paraspinal muscles हैं, उनकी stretching that is required. You can go for the ISTM. You can go for the cupping therapy to release the tight muscle, and you can go for the strengthening of the that weak muscle, that is core muscles. Got
Okay,
it?
sir. Okay, thank you, sir.
Welcome,
सर मैं एक
welcome.
क्वेश्चन है सर. क्या
Hello,
हम
sir.
लिगामेंट इंजरी में सर कायरो कर सकते हैं?
आवाज कम आ रहा है आपका.
हेलो सर,
आवाज
आवाज आ रही है?
हाँ
आवाज आ रही है सर?
हाँ, बोलिए बोलिए.
सर क्या हम लिगामेंट इंजरी में कायरो कर सकते हैं?
ये जो बहुत एडवांस टेक्निक है उसमें हम कायरोप्रैक्टिक करते हैं, लेकिन जो लिगामेंट इंजरी है उसमें भी डिपेंड करता है ग्रेड 1 2 3 4 कितना है. ग्रेड 3 से ऊपर का है, रेफर द केस फॉर द रिकंस्ट्रक्टिव सर्जरी. रिकंस्ट्रक्टिव सर्जरी होगा उसमें. लेकिन ग्रेड 2 3 से कम है तो वी कैन गो फॉर द एडजस्टमेंट, एंड आफ्टर दैट एडजस्टमेंट गो फॉर द ड्राई नीडल थेरेपी, एंड आफ्टर ड्राई नीडल थेरेपी गो फॉर द टेपिंग टेक्निक. हार्ड जो टेपिंग होता है वो करके हम रिकवरी दे सकते हैं पेशेंट को. गो फॉर द लेजर ऑल्सो. लेजर भी यूज करते हैं. लेजर से हीलिंग बहुत अच्छी होती है.
So ligament
Hello,
injury
sir.
में chiropractic करके क्या
Hello,
फायदा
sir.
होगा? Like what will be the changes we can see from chiropractic during ligament injury grade 1?
लिगामेंट इंजरी बेसिकली क्यों हो रहा है? हमारा ये नी ज्वाइंट अगर आप देखोगे तो इसमें जो हमारे लिगामेंट्स हैं, देयर आर डिफरेंट लिगामेंट्स. एसीएल इंजरी मान लो हो रहा है, तो एसीएल इंजरी क्यों हो रहा है? व्हाई इट इज हैपनिंग एसीएल इंजरी? बिकॉज जो बोन स्ट्रक्चर है वो अपने नेचुरल पार्ट से डिस्प्लेस हो रहा है. जैसे डिस्प्लेस होगा, हमारे लिगामेंट के ऊपर प्रेशर डालेगा एंड देयर विल बी टीयर इन द लिगामेंट. सो व्हाट वी आर डूइंग, वी आर करेक्टिंग दैट displacement of the bone. After that we are अप्लाइंग टेपिंग टेक्निक. टेपिंग से हम जो मूवमेंट है उसको रिस्ट्रिक्ट करेंगे. लेजर थेरेपी से हीलिंग प्रोवाइड करेंगे. दैट इज द मेन ट्रीटमेंट फॉर द लिगामेंट इंजरी.
Just
हेलो
just a
Hello, sir.
question.
Myself,
About the
Tejas
follow up with
Srivastava.
the
Am I audible, sir?
तेजल, यस प्लीज टेल.
Sir, is it necessary to hear a pop-up sound during a cryopractic?
Very good question. This is the question for which I was waiting since morning. This is the very good question. No, my dear friend, pop-up sound is not chiropractic adjustment. Chiropractic adjustment is the adjustment for the fault. You have to find out the fault and correct that fault. No need to get the pop-up sound. If the patient is asking that I'm not getting the pop-up sound, just ask them to go to another chiropractor who is just producing the chiropractic sound. No, it is not required. Just do the proper assessment and do the proper management. That's it. No chiropractic is equal to pop-up sound. Okay.
Okay,
पुनीत
thank you
सर
so much, sir.
Welcome.
पुनीत सर, इट इज
Hello, sir.
त्रिपाठी. हेलो. हाँ
जी
पुनीत
सर,
सर, इट इज
What is
त्रिपाठी
pop-up
सर.
sound?
एक एक करके
Sir, what is
पुनीत सर,
pop-up sound?
बोलिए बोलिए राजेश जी बोलिए.
सर एक चीज ये पूछना था. इन केस ऑफ माइग्रेन कैन
Hello,
वी
sir.
मैनिपुलेट C1 and C2?
फर्स्ट सर रिपीट करिए, बीच में किसी ने कुछ बोल दिया, आप दोबारा रिपीट करिए.
सर इन केस ऑफ माइग्रेन कैन वी मैनिपुलेट C1 and C2
Yes,
to
migraine
root
is
out
due to
that
the
thing?
compression in the upper cervical spine. So if you will correct the cervical two vertebra, that migraine will vanish away.
Okay, thank you,
Sir,
sir.
sir,
Welcome,
bulged
sir.
disc will go back to its original position. So a lot of patients ask the same question. Bulged
Sir,
disc protruded, will it go back to its original
yes, I had
position?
already explained in my PPT presentation that you can do the proper management for the disc bulge. If there is any disc bulge, just do the proper adjustment that will go to its natural place. Okay, sir.
Hello,
Sir,
sir.
in case, hello, sir.
Myself, Kundan.
Voice नहीं आ रही. I'm not getting the voice.
Hello, sir.
जी
Myself Farida Khatun.
बोलिए बोलिए.
सर फीमेल पेशेंट है, उसको सियाटिक पेन हो रहा है, तो उसे यूट्रस फाइब्रॉइड भी है, तो क्या उसे हम दे सकते हैं कायरो
Adjustment
ट्रीटमेंट
कर सकते हो.
लैम्बो?
If you have the female patient in pregnancy, chiropractic adjustment is contraindicated. If the patient is having the periods, दो first 3 days में menstrual cycle जब हो रखा है, उस समय लंबो sacral adjustment नहीं करना चाहिए. बाकी समय आप कर सकते हैं unless and until there is
सर
any.
जैसे यूट्रस में फाइब्रॉइड होता है और
Go for it.
सियाटिक पेन भी हो रहा है, तो
Go for
दे
it. Go
सकते
for it.
हैं?
हाँ, go for the gentle mobilization.
ओके सर, थैंक यू.
Sir, Puneet sir, it's again Tripathi from this side.
सर बोलिए.
सर एक चीज ये पूछना था. रोटेटर काफ इंजरी है फ्रॉम लास्ट 3 months. कैन वी गिव सम मैनिपुलेशन इन शोल्डर और नॉट?
Yes, you can go for the manipulation, do the proper correction of the shoulder joint. After that, you can go for the dry needle therapy and taping. It will work beautifully.
थैंक यू सर.
Welcome,
Hello,
sir.
sir.
हेलो.
This
Hello.
side Kundan
हेलो सर.
from Bihar.
हाँ.
बोलिए कुंदन जी.
Sir, cervicogenic headache में how much session of chiropractic for the treatment?
Depends upon the rotation of the vertebra. If there is any rotation in the vertebra, it depends upon your assessment and treatment. Generally, we see a lot of cases who is having the cervicogenic headache, that headache which is originating from the neck region to the head. You can do the adjustment in 1 or 2 sessions. The patient will be fully cured.
Thank you, sir.
Welcome, Kundan ji.
Sir, I am
Hello, sir.
audible.
हेलो
Hello, sir.
सर.
Hello,
It's
sir.
again
I
me.
am audible. Myself, Janvi.
बोलिए.
सर, अगर किसी का लिम्ब शॉर्टनिंग है तो पेल्विक से उनका अगर पेल्विक टिल्ट है तो क्या वो कायरो से एडजस्टमेंट हो सकता है?
मैडम जानवी जी, देयर इज चांसेस ऑफ 2 टाइप्स ऑफ लिम्ब शॉर्टनिंग. एक लिम्ब शॉर्टनिंग होती है जो कि फिजियोलॉजिकल लिम्ब शॉर्टनिंग है. एक लिम्ब शॉर्टनिंग होती है जो कि एनाटॉमिकल लिम्ब शॉर्टनिंग है. जैसे किसी पेशेंट को अगर TKR हुआ है, THR हुआ है, देयर इज हिस्ट्री ऑफ द एनी सर्जरी, उसके बाद में अगर लिम्ब शॉर्टनिंग होता है, दैट कांट बी क्योर्ड बाय द chiropractic एडजस्टमेंट. बट इफ देयर इज एनी फिजियोलॉजिकल लिम्ब शॉर्टनिंग that is due to the rotation in the pelvic, that can easily be cured and that can easily be corrected by chiropractic method. Have you got my point?
यस सर. सर एक्चुअली
Welcome.
मेरी ही लिम्ब शॉर्टनिंग है
हम्म.
और कोई भी मतलब मेरा TKR कोई भी सर्जरी नहीं हुई है. ऑर्थोपेडिशियन ने सर्जरी सजेस्ट की थी बट माय पेरेंट्स इज नॉट अलाउड बिकॉज आई एम अ
भाई
गर्ल.
सर्जरी के लिए बोला, क्यों बोला है?
उन्होंने बोला हिप टू एंकल आपकी पूरी जो है आपकी सर्जरी होगी. मेरे पास एक्सरे है सर, मैं आपको पर्सनली सेंड करूंगी.
आप भेज
उसमें
दीजिएगा. Is there
यस.
any fusion in the hip joint?
नो सर.
There is no fusion. You have the X-ray of your pelvic.
यस सर.
No fusion. Then why surgery is required?
सर आई हैव नो आइडिया.
Nah, you just want to donate your body to surgeon for surgery. You
नो
can
सर.
donate your. No need to go for the surgery. If there is any physiological shortening, we can correct it by chiropractic method, my dear.
Physiological, not anatomical.
There may be chances of physiological shortening.
Yes, sir.
Don't donate your body to surgeon for surgery.
Yes, sir. Sir,
Just,
I'm
just
personally to
send me
meet.
your all details on my WhatsApp number.
Yes,
Okay.
sure,
I will,
sir.
I will see and suggest you what you can go for it.
Thank you so much, sir.
Welcome.
Puneet sir, one last question of mine is that in case of vertigo, we can manipulate cervical vertebrae or not?
My dear Rajesh sir, from which city you are?
I'm from the Lucknow, sir.
Oh, you are in from Lucknow. Come to my clinic.
Yeah.
We will discuss each and every question. You have a lot of questions. Please come to my clinic. We will have one coffee with you and we will discuss a lot of things.
No
See,
problem.
sir, I will give the answer. Vertigo, as far as the vertigo is concerned, there are two kind of vertigo. One which is coming from the cervical region and one which is coming from the disturbance in your earlobe. Earlobe में हमारे ear में there is one liquid which is known for the disturbance in the imbalance, that is known as BPPV, which is basically caused by the positional vertigo. Positional vertigo means when the patient is changing the position, then there is vertigo. And in cervical region, if there is any compression, that vertigo comes to any position. Patient is having sitting, patient is walking, then also they will get that vertigo. But
Sir,
positional
that is the problem. They don't have any ENT problem. They have basically cervical vertigo.
Sir,
so for that, what we have to manipulate? Which cervical vertebra we have to manipulate?
Sir, just ask the patient to go for the X-ray. X-ray
Sure.
देखिए which vertebra is compressing, where is the reduction of the space with which vertebra, and clinically उसके symptoms देखिए कि उसको if there is any localized pain or if there is any radiculopathy हो रही है तो कौन से vertebra की radiculopathy है, किस myotomes में जा रहा है, कौन सा dermatomes जा रहा है, उसके हिसाब से आप treatment कर सकते हैं.
Okay, sir. Thank you, sir.
Welcome जी
Sir,
राजेश.
it's again me. Sir, I want to ask a last question.
बोलिए सर.
Sir, as you say, you done Cairo on 90-year-old patient. So I want to know that how can we know that the patient is in need of Cairo and it's beneficial for them?
नहीं, it depends upon the case. If you are the patient is healthy enough, it don't like that the age में मतलब नहीं है. पेशेंट का फिजिक कैसा है. अभी जो फॉरेन के लोग हैं वो 70 ईयर 80 और दे आर मच हेल्थियर देन आवर. अभी मेरे से ज्यादा वो स्मार्ट होंगे, मेरे से ज्यादा हेल्दी होंगे, उनका बॉडी स्ट्रक्चर अच्छा होगा. तो बॉडी स्ट्रक्चर के ऊपर डिपेंड करता है कि बॉडी स्ट्रक्चर कैसा है. कोई जरूरी नहीं कि 65 से ईयर के अबव के जो हैं सबको ऑस्टियोपोरोसिस हो रखा है. इफ द पेशेंट इज हेल्दी इनफ, they want to go for the chiropractic adjustment, do the proper assessment, do the palpation. That is very important. When you start doing the chiropractic adjustment, you will become more smarter in doing the palpation. मैं जब palpate करता हूँ, मैं देखता हूँ तो मुझे फील आता है कि यहाँ वर्टिब्रा किधर जा रहा है, पोजीशन कैसा जा रहा है, उसके हिसाब से कैसा थ्रस्ट देना है, हम थ्रस्ट देते हैं उसमें. That is very easy task.
Sir, where is your workshop done?
सर रिपीट करिए, क्या बोल रहे हैं.
सर, आपकी वर्कशॉप कहाँ होने वाली है?
बस अभी बेंगलोर में होने वाली है, उसके बाद मुंबई दिल्ली सब जगह होती है अपनी वर्कशॉप. आप ग्रुप में
लखनऊ में कब है?
आपको मिलेगा भी.
सर हाँ,
लखनऊ में कब है
दिल्ली के
सर?
करीब.
लखनऊ में भी जल्दी होने वाली है.
हेलो
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 सर,
सर,
दिल्ली
दिस
का
इज
कब होगा
शांति
सर?
फ्रॉम दिस.
सब इंफॉर्मेशन देंगे, डेट्स निकालेंगे और उसमें शेयर करेंगे
हेलो
ग्रुप में.
सर, एम आई ऑडिबल?
यस
थैंक
यस
यू सर,
प्लीज
थैंक यू वेरी मच.
वेलकम.
Sir, can we do chiropractic in recent catch like spasm for neck?
रिसेंट
Catch. Like
हाँ,
if
स्पाज्म
there
इज
is.
देयर. Just before applying the chiropractic adjustment, it is advisable to release the spasm. Just apply the hot pack, go for some release technique, go for some ISTM, go for cupping therapy to reduce the spasm. After relieving of the spasm, go for the chiropractic adjustment. Okay, Chandni ji?
Okay. Yes, sir. Thank you.
हेलो
Welcome.
सर. हेलो.
हेलो
हेलो.
हेलो.
सर, अगर लिम्ब लेंथनिंग हुआ हो उस पे क्या नी में पेन हो तो कैरो कर सकते हैं क्या उस पे?
हाँ कर सकते हैं.
ओके.
अदनान सर, it's 11:15 सर.
We'll wind up, sir.
Yes, yes, I had already given so many answers to any question.
Sir,
If you
excuse me,
can
sir,
share
a
your
question, sir. I
question.
am waiting for many
Hello,
times.
sir. My last question.
Just one request. Can you please excuse me for 30 seconds? I just want to go to the washroom. Just 30 seconds. I will give the reply to everyone. Just excuse me for 30 seconds, please.
Okay, sir.
Sure, sir,
You
sure.
can do it.